Hello again, everyone. Welcome back to our webinar series. All of our webinars are created for parents with special needs, children, and teens. So if you're a parent, caregiver, or if you have a family member with autism, ADHD, or learning disabilities, these contents are meant for you. Today's webinar will be focusing on social skills, and it'll be like a DIY, do-it-yourself workshop to create your very own lesson plan for your child. If you have a child who's having a hard time adjusting to peers, making friends, or maintaining those friendships, hopefully you'll leave today's webinar with some ideas to get started. I know social skills is such a broad concept, so I tried my best to really narrow it down so that regardless of where your child is currently standing in terms of his or her social skills, you should be able to find a starting point. This webinar is being presented by our Village program. I'd like to share a little bit about us. We are a special education team with professionals of all different fields. We have speech pathologists, BCBA like myself, nurses, program specialists, and much more. And in short, we are the SPED department to provide that tailored support that families need. So if you're interested in support with one-to-one consultations, to school IEPs, please stay with us until the end of this webinar where I'll briefly introduce ourselves a little bit more. To introduce myself, my name is Stephanie Lee and I'm a BCBA. I've been working in the field primarily with children and teens with autism and ADHD under the practice of applied behavior analysis or ABA. So you'll notice some of its practice in our contents today. On our agenda today, we will be discussing social skills in depth and its importance to your child's future, a simple guide to building that DIY social skills teaching plan, and some additional strategies to coaching those social skills. So let's begin. We all know that social skills is very important and we all know what it is in a nutshell, but I'd like to discuss the concept from a behavioral perspective. The American Psychological Association defines social skills as a set of learned abilities that enable an individual to interact competently and appropriately in a social context. Matson and colleagues defined social skills as interpersonal responses that allow the individual to adapt to the environment through verbal and nonverbal communication. So, in case you're wondering what those verbal and nonverbal types of communication are, verbal responses are those that include the tone and volume that we use depending on the context. Rate and clarity of speech is kind of what we use when we talk to one another. On the other hand, nonverbal responses include body gestures that we use when we interact with one another, and these include eye contact, facial expression, posture, social distance, gestures, or social cues, and listening skills. While we're doing this deep dive into social skills and all the behaviors that are relevant to it, I'd also like to briefly introduce the DSM 5 criteria for autism, ADHD, and ODD. So, the DSM 5 is a manual that health professionals use to classify disorders, and I specifically included these three just because some of their traits are directly linked with social skills. And I won't go into too much detail, and obviously, this is not the entire complete list that they have. But if you are interested in the complete, thorough criteria or list of these disorders, please feel free to check out on CDC's website, or you can even Google search. The first disorder that I wanted to talk about was autism spectrum disorder. Some of their traits include persistent deficits in social communication and social interaction across multiple contexts. We might see deficits in social emotional reciprocity, and this includes those back and forth conversations, reduced sharing of interests, and also a failure to initiate and respond to those interactions. There's also deficits in nonverbal communicative behaviors, like the body gestures that we spoke about, and deficits in developing, maintaining, and understanding relationships. And there's much more to this, but let's move on to ADHD. For ADHD, I've pinpointed inattention, so we might see trouble holding attention, not listening when spoken to, or easily distracted. And all of these can be troublesome when we're trying to focus on social skills. We also have hyperactivity and impulsivity, which can often look like on the go or acting as if driven by a motor. We also have talking excessively, blurting out an answer before the question, having trouble waiting for their turns, and interrupting others. Again, these are just some of the criteria that can interfere with an individual with ADHD during social interactions. Lastly, we have oppositional defiant disorder, and some of the underlying traits that I've noted include a pattern of angry and irritable mood, argumentative and defiant behavior, or vindictiveness. This can be quite troublesome, again, especially if we have a child demonstrating these traits with other peers or any other individuals that they're trying to socialize. So we went into a pretty thorough deep dive into what social skills encompasses. So let's talk about why it's so important. Social skills are crucial for any developmental age. They encourage communication and language development. They allow exchanges with peers and authority figures. They allow development of positive and meaningful relationships, which I think is most important. They may also improve academic performance. It may also improve independence and transition into adulthood. So, in conclusion, social skills are such a critical component for any age. The earlier that we can start teaching these skills, the better. So, we got all the what and whys out of the way. Let's begin with that DIY teaching plan. I'll be going over the steps briefly right now, but in the next few slides, I'll also be guiding you along with an example that I have. So, step one, we want to observe the child. We want to recognize his or her strengths and challenges. Many of our parents usually are already aware of their child's strengths and challenges. As a BCBA, when parents come to me with concerns or during consultations, they're very, very knowledgeable what their child can do and what they cannot do. However, if you'd like to see how they do, bring them to a local park or where there's a lot of other peers, or even ask your child's teacher or other service providers that are working with your child. That might give you a better idea. Also, keep in mind that some of our kiddos who do amazing with adults or family members might not demonstrate that same level of skills with their similar age peers. So that's something to consider during your observations as well. Moving on, step two, we have select a few developmentally appropriate skills to teach. We'll be going over them. Step three, apply the behavior skills training method to coach your child. We'll be going over that too. And lastly, step four, continue to create opportunities for your child to perform the skill in natural and contrived settings. So let's put this all together. In the next few slides, I will be going over some different skills in different levels. So this is where I'm going to talk about the few developmentally appropriate skills to teach, which is step two. I'll begin with prerequisite skills and then we can get into beginner, intermediate, and advanced skills. And I intentionally did not include ages for this because I feel that we want to create this plan according to their current skill set, not age. And we definitely want to consider their age, but we want to put a heavier emphasis on their current skill set. So as we go through the different stages and levels, see where your child currently fits. If your child currently fits in the beginner level, then great. If your child already mastered all the beginner level criteria, then move on to intermediate and so on. So these prerequisite skills, these might sound very basic, but these are actually those fundamental, very, very basic skills that we want to firmly establish before we want to move on. So these include learning readiness skills, which might include the ability to sit down and attend to something for at least a couple of minutes, eye contact to different materials or to the speaker or the teacher, and being able to focus for at least a couple of minutes. We also have communicating wants and needs, like saying, I want, give me, following simple instructions with adults, imitating one-step actions with adults, tolerance to waiting, and challenging behaviors that occur at manageable rates and are easily redirected. So if your child has all of these skills, great. We can move on to our beginner skills. If not, we can continue to work on this. But beginner skills includes requesting from peers, initiating and responding to greetings from peers, imitating simple and complex actions by peers, sharing, turn taking, and following complex instructions. For intermediate skills, we have requesting for help, requesting for attention, like, look, check it out, making eye contact or orienting body towards the listener or speaker, cooperative and interactive play with peers, pretend play, initiating simple conversations, contingent commenting, like, I see, I like, I want, joining play, and stranger awareness. Advanced skills are kind of those skills that are most complex and obviously advanced. These are the kind of skills that I like to teach to our older children or preteens, teens, or young adults. So we have initiating and maintaining conversations, staying on topic, waiting for a turn to speak, using appropriate transition statements, maintaining personal space, perspective taking, conflict resolution skills, identifying sarcasm, identifying social cues, recognizing and responding to bullying and teasing, telephone skills, and competitive play like board games or video games or sports. So again, step one, we observe our child. Step two, we select a few developmentally appropriate skills to teach that we just discussed. And step three is to apply the behavior skills training method to start coaching or teaching your child those specific skills. So at this point, you may have selected a few skills to teach your child. Let's discuss how we can teach those skills. I'd like to introduce a powerful evidence-based approach called behavior skills training, or BST, that you can use. And BST is used in a wide variety of different settings, not just in our field of ABA, but a lot of different companies and a lot of different fields also practice BST. But us as BCBAs, as professionals, we use it to train our staff, but we can also use it to train parents and caregivers to implement those parent-led teaching opportunities, and we can also use this to directly work and teach our children or teens or adolescents as well. And it consists of 4 simple steps. So one is providing instructions, whether it's verbal or written instructions. It can also be visual. Step 2, model what is expected. Step 3, role playing the skill with the child or creating some structured opportunities for your child to perform or practice those skills. And lastly, step 4, feedback, providing specific feedback, corrective feedback, or any praises based on the performance or how your child did. So as of now, we went over steps 1, 2, 3. The last step would be to continue to create opportunities for your child to perform the skill in natural or contrived settings. And we want to create as many opportunities as possible to have your child practice those skills. So now that we went over steps 1 through 4, let's put it all together. I'm going to walk you through each of the steps, pretending that I'm a parent creating this teaching plan for my son. And let's pretend my son's name is Johnny and that he's 4 years old. So number 1, we want to observe little Johnny. We want to recognize his strengths and different challenges. I can obviously gather information at home, and as a parent, I should be aware of his current strengths and weaknesses, but it might be a little limited unless I have some similar age siblings at home, or I have a lot of family members who are similar in age as little Johnny. But regardless, I might also check in with the school teacher to see how he's doing with other peers at school. But just because I want to know a little bit more, I bring him to a park where I know there's a lot of other peers around. I'd like to see if he's interacting with others, how he's interacting, and I'd also like to focus on some areas that I can start targeting. So, for example, I might be thinking, is he sharing with others? Is he maintaining conversations with others? How's he responding to other peers approaching him, and so on? So after I do my observation and I gather some information about Johnny, next step is for me to select a few skills to teach. And this has us go back to our prerequisite, beginner, intermediate, and advanced social skills list. So I would look through my list and I see that little Johnny fortunately has all of the skills under prerequisite skills. This is great. He has all the foundational skills for me to start teaching him the specific skills related to social skills. So I move on to beginner. Under beginner skills, I see that he has initiating and responding to greetings from peers, imitating simple and complex actions by peers, and following complex instructions. However, I see that he does not have skills to request from peers. Maybe I notice that whenever he wants to ask for a turn or a toy or for their attention, he doesn't know how, and he doesn't share nor take turns. So let's say he wants to whine or yell no when asked to share. So now that I have a starting point, I have a couple of things that I'd like to teach him before I move on to the more advanced social skills under intermediate and advanced social skills. So, step three, we want to apply the BST method to start teaching little Johnny those two skills that I've pinpointed. Again, BST involves those four steps that I've mentioned. I'm going to pause here. This is a great opportunity for me to show or demonstrate a glimpse of some of the contents that are included in our Village program. So this pamphlet that you see here is a step-by-step lesson plan that parents can use to teach a variety of different skills to their child. So these lesson plans have the purpose of that skill of why it's so important to teach, the materials that are required, instructions, and some additional considerations too. So for this specific scenario, I've chosen a lesson plan on turn taking. So this is where I can use the BST or behavior skills training method to teach turn taking and sharing to little Johnny, and I can use this pamphlet as a little guide. After I finish teaching little Johnny, I would like to continue to create opportunities for him to perform that skill in the natural or contrived setting. Maybe at home, I can work on having him practice sharing and turn taking with me or with his siblings if he has any. During play dates, I could also try to structure and facilitate those sharing opportunities. Um, but in my specific scenario, let's say that I bring him back to the park so that he can practice the skills that I taught him. Of course, I'd like to practice these skills with myself at home, but we want to have him practice and utilize his newly acquired skills in a variety of different settings. That's why bringing him to different locations and different environments is very, very important. So here, once I bring him to the park, I would like to see whether he is sharing and taking turns with his peers. And most importantly, if I see that he needs help, I could also intervene and also remind him of some of the things that we've practiced. If you're looking for some other strategies that might supplement what we have, I recommend the following. So, cartoons and videos are great at serving as different models for children to utilize those social skills. So cartoons and videos would be a great one. Storybooks or even social stories. We have a lot of stories that you can find in the library that involve the social skills and practicing social skills, some games, and as previously mentioned, creating opportunities for natural opportunities. Lastly, I highly recommend seeking professional assistance too. Speaking of professional assistance, our Village program offers great benefits. So we provide unmatched customization, expert guidance with IEPs, which also include a comprehensive IEP checklist. We also have a private community of different parents, a resource library that we provide to our parents, and on-demand support from specialists of all different fields. So if you need to have consultations with a professional who is more experienced with IEPs, you can go ahead and schedule yourself with one with BCBAs, speech pathologists, and so on. Some free parent resources that we do provide are attached to our website. You can find, these are just a few, you can find some on personal space. The ones that are relevant to social skills are listed here. Teaching your child to respond to bullying, teaching social cues. Again, that's that lesson plan that I introduced a few slides ago, and even printable worksheets. So these resources are actually from our resource library. So our resource library has three different categories. We have parent resources that share a variety of different topics of different things. These are mostly for parents to use. We also have those lesson plans that I've discussed. Some of them are on behavior management and other skill acquisition procedures. And we also have printable activities, like I've mentioned, that we can download, print, and present to our children. And we have it on all different ages and grade levels. So if you are ever curious about us, please feel free to check us out on our website. You can also feel free to call our office at 844-387-5836. We also have our company's website. If you have any specific questions for myself, feel free to contact me. And my contact information is listed over here. Thank you so much. That concludes our webinar today. I hope you have a great rest of your day. If you have any further questions again or comments for us, we'd love to hear from you. Thank you.